I am Dr. Claire Vega, and I need you to stop what you are doing right now. Walk into your kitchen, open your refrigerator, look at the plastic containers sitting on that shelf. That is where the danger is hiding. Not in a dark alley, not in a hospital, in your own refrigerator. In the leftovers you saved last night because you were raised to never waste food. The cancer industry is counting on that habit. The appliance industry is counting on that habit. And the medical system that is supposed to protect you is staying completely silent while you slowly poison yourself at your own kitchen table. Today I am exposing 5 specific foods that become chemically toxic the moment you reheat them. Your doctor has read the research. The oncologists know the data. The food corporations buried the clinical studies 20 years ago. Nobody told you. That ends right now. Let me first explain what your pancreas actually does, because your doctor has never taken 7 minutes to explain it properly. Your pancreas is a soft, delicate organ tucked deep behind your stomach. You cannot feel it. You cannot see it. But it is working every single minute of your life. It produces the digestive enzymes that break down every meal you eat. It regulates your blood sugar. It is your body's ultimate internal chemical filter. And it is incredibly fragile. When you repeatedly flood your pancreas with toxic food compounds, the delicate cells begin to break down. They become inflamed, they scar, and scar tissue is exactly where cancer cells hide and quietly grow. Pancreatic cancer has one of the lowest survival rates of any cancer in existence. Most patients are dead within 12 months of diagnosis. The doctors tell you it is bad luck. They tell you it is genetics. They shake their heads and send you to the oncology department. They never once ask you how you heat your lunch. That question costs them billions of dollars every single year. Food number 1, leftover spinach and leafy greens. You grew them in your garden. You bought them fresh at the farmer's market. You cooked them carefully for a healthy dinner. You did everything right. Then you put them in the refrigerator overnight. And the next day, you put that plastic container in the microwave. That single decision changes everything. Fresh leafy greens are packed with natural nitrates from the soil. Those natural nitrates are genuinely good for your heart. They support your blood pressure. They help your circulation. But microwaves do not cook food gently. They blast food with intense radiation. That radiation chemically destroys the healthy nitrates. It transforms them into dangerous compounds called nitrosamines. Nitrosamines are among the most aggressive cancer-causing agents ever documented in clinical science. The oncology community has known this for decades. Does your microwave have a warning label about nitrosamines? No. Does your doctor mention it at your annual physical? No. Does the federal food regulator require any disclosure at all? Absolutely not. They wait. They are very patient people. They wait until your pancreas completely breaks down. Then they charge you $500,000 for a chemotherapy protocol that extends your life by an average of 11 months. Now let me tell you about George. George is 73 years old. He built his backyard garden from scratch 30 years ago. He grew tomatoes, peppers, and leafy spinach. He was proud of eating food he grew with his own hands. Every single day for lunch, George microwaved his leftover spinach. He thought he was the healthiest man on his street. He told his wife he was going to outlive everyone in the neighborhood. Last winter, George developed a deep, persistent ache in his upper abdomen. He ignored it for 2 months the way men his age always do. When the pain became unbearable, he finally went to the clinic. The young doctor did not look up from his laptop. He told George it was probably a pulled muscle. He wrote a prescription for ibuprofen. He sent George home in 4 minutes. 3 weeks later, George collapsed in his kitchen. The hospital scan showed advanced pancreatic cancer. The oncologist asked about his family history. She asked if he smoked. She asked if he drank heavily. She never asked about the leftover spinach he microwaved every day for years. I looked George in the eye and told him the truth his doctor refused to tell him. His own kitchen destroyed him. The system that was supposed to protect him failed him on purpose. You must throw those leftover greens away tonight. They are not worth your life. Food number 2, leftover chicken. You have cooked chicken in your refrigerator right now. I am almost certain of it. Chicken is an excellent source of lean protein. The first time you cook it, the protein molecules fold into a stable, digestible structure. Your stomach handles them easily. But here is what happens when you reheat cold chicken. The second wave of heat aggressively alters those protein structures. It creates what scientists call denatured protein byproducts, compounds that do not exist in nature, compounds your digestive system was never designed to process. Your stomach cannot break them down efficiently. Your pancreas is forced to work dramatically harder to compensate. The chronic overwork creates deep, sustained inflammation inside the organ. Chronic inflammation is not just uncomfortable. Chronic inflammation is the match that lights the fire of cancer. The meat industry knows this biological reality. They spend hundreds of millions of dollars every year on television advertisements. They tell you to buy the family pack. Save the leftovers. Be smart with your grocery budget. They never mention the protein mutations. They never disclose what the second heating cycle does to the tissue structure. Your doctor sees the inflammation markers on your routine blood panel, but they never connect the dots. They never ask you how you cook your meals. Asking that question does not generate a prescription. It does not generate a referral. It does not generate revenue. Eat your leftover chicken cold, straight from the refrigerator. The cold temperature does not trigger the toxic protein reaction. But the moment you put it back under heat, you are poisoning yourself quietly and legally. Food number 3, leftover white potatoes and French fries. You went out for dinner last week. You brought home the extra roasted potatoes, or the leftover fries from the grandchildren's plates. You heated them up the next afternoon. You just created a compound called acrylamide. Potatoes are loaded with dense, heavy, natural starches. When you blast those starches with high heat a second time, the starches chemically fuse with the residual cooking oil still present in the food. Acrylamide is the result. It is not a naturally occurring food compound. It is an industrial chemical. It is used in manufacturing plastics. It is used in water treatment processing. And you are serving it to yourself for Tuesday lunch. Your pancreas absorbs that industrial chemical rapidly. The toxic load accumulates with every reheated portion. The damage builds silently over months and years. Let me tell you about Stanley. Stanley spent his entire working life in construction. He built things with his hands. He was proud of that. He retired with a modest pension and looked forward to quiet afternoons on his back porch. Stanley hated wasting food. His mother raised him to clean his plate and save what was left. He reheated his leftover potatoes every single week in a cast iron pan with butter. He thought he was being responsible. When his skin turned a deep, disturbing yellow one morning, his wife rushed him to the emergency room. The jaundice was advanced. The scan was immediate. There was a massive tumor on his pancreas. The specialist asked condescendingly if Stanley drank heavily. Stanley barely touched alcohol. The doctor shrugged. He talked about genetic predisposition. He mentioned environmental factors in vague, dismissive terms. He never once asked about the acrylamide Stanley ate every week for 11 years. They blamed Stanley for his own destruction while completely protecting the corporations that caused it. Throw away the leftover potatoes every single time, no exceptions. Food number 4, leftover white rice. The agricultural industry calls rice the perfect global staple food. Affordable, filling, versatile. They sell it by the 50-pound bag and tell you it is the foundation of a healthy diet. Here is what they never put on the label. Uncooked rice contains dormant bacterial spores naturally present in the grain. When you boil the rice, those spores do not die. Boiling water is not hot enough to kill them. When your cooked rice sits on the counter cooling down, those spores wake up. They multiply rapidly at room temperature. They produce an invisible toxic byproduct called cereulide. You cannot see cereulide. You cannot smell it. You cannot taste it. When you refrigerate the rice overnight and reheat it the next day, the heat does not destroy the cereulide. The heat actually bonds the poison more tightly into the individual grains. You eat the warm rice. The poison travels directly into your digestive tract. Your pancreas detects the toxic invasion and mounts an emergency response. It fails to neutralize the compound fully. Repeated toxic shocks over months and years cause microscopic scarring on the pancreatic tissue. That scarring does not heal. It accumulates silently. The medical system calls this outcome simple food poisoning when it causes acute symptoms. They tell you to rest and drink fluids. They aggressively hide the long-term organ damage they know is building underneath. The rice corporations need you buying giant bags every month. The grocery chains need the profit margins from bulk grain sales. The hospital systems need the cancer patients those habits eventually produce. Every link in that chain profits from your ignorance. Treat cooked rice as a strictly one-time meal. Cook only what you will eat immediately. If rice is left in the pot after dinner, it goes in the trash tonight. Food number 5. Reheated processed deli meats and leftover bacon. This is the worst offender in your entire kitchen, and it is probably sitting in your refrigerator right now. The meatpacking industry legally injects processed deli meats with synthetic chemical preservatives. They use manufactured nitrites to keep old meat looking bright red and fresh on the shelf. They pump your breakfast bacon full of the same compounds. When you fry bacon the first time, a chemical reaction begins. The heat starts converting those synthetic nitrites into new compounds. But when you cool that meat down and reheat it a second time, the reaction becomes catastrophic. The intense second wave of heat transforms the preservatives into what scientists classify as highly volatile N-nitroso compounds. These compounds enter your bloodstream within minutes of eating. They travel directly to your pancreas. Inside your pancreatic cells, these compounds do something terrifying. They interact with your cellular DNA. They do not just cause inflammation. They rewrite instructions inside your healthy cells. They command normal cells to begin uncontrolled cancerous growth. The government food regulators have access to this research. They have reviewed the clinical data on N-nitroso compounds for decades. But the massive meat conglomerates spend tens of millions of dollars every single year lobbying politicians in Washington. They fund political campaigns. They host expensive fundraising dinners. They have attorneys on retainer specifically to keep warning labels off their products. If you bought a bottle of industrial bleach, it would carry a large poison warning by federal law. But they allow documented cancer-causing compounds to be served as a normal American breakfast without a single word of warning. That is not negligence. That is a deliberate, profitable decision. If you have leftover bacon in your refrigerator right now, throw it away before you go to bed tonight. Eat your bacon fresh. Eat it once. Never reheat it under any circumstances. Now let me tell you what the early warning signs of pancreatic damage actually feel like, because your doctor is going to miss them. I am telling you that directly. You might feel a persistent dull ache in your upper back that no position relieves. You might notice your appetite dropping gradually with no obvious reason. Your digestion may feel sluggish and unpredictable. Your skin might take on a faintly yellowish tone that your bathroom mirror makes easy to dismiss. You walk into the clinic with these concerns. The doctor glances at their watch. They tell you the back pain is muscular. They tell you the appetite change is stress. They hand you a pamphlet about healthy eating and send you home. They are not incompetent. They are operating inside a system that profits from late diagnosis. An early diagnosis costs the hospital system almost nothing. A late diagnosis generates hundreds of thousands of dollars in procedures, imaging, chemotherapy, and extended inpatient care. The financial incentive is not on your side. That is why you must know these warning signs before the system dismisses them. Here is exactly what you must change starting tonight. Cook only what you will eat in one sitting. That is the most powerful thing you can do. If you have leftover spinach or leafy greens, trash. If you have leftover rice, trash. If you have leftover potatoes, trash. If you have cooked bacon left on the plate, trash. Do not let anyone make you feel guilty for throwing away 50 cents worth of food. The food corporations want you to feel that guilt. They designed that guilt. They use it to keep you trapped inside their poisonous cycle. Your pancreas cannot be replaced. Your life cannot be replaced. The silence from your doctors is unforgivable. They took a sacred oath to protect your health from harm. Instead, they protect corporate profit margins and comfortable appointment schedules. They are not going to warn you. Your insurance company is not going to warn you. The government regulator is absolutely not going to warn you. You have to protect yourself. Starting with the meal you cook tonight. You worked your entire life to reach this point. You earned the retirement you are living. You deserve to see every year of it clearly and in good health. Do not hand that life over to a cancer clinic because nobody told you the truth about leftover rice. I am Dr. Claire Vega. I am digging through the buried research papers they never want you to find. I am exposing the billion-dollar lies they built their industry on, and I am not stopping. Hit that subscribe button right now, because my next video exposes a specific blood pressure pill your doctor is prescribing today that is quietly destroying your kidneys. They know the damage it causes. They prescribe it anyway, because the replacement drug costs 4 times more, and the pharmaceutical company pays generously for every prescription written. You need to know which pill it is before your next appointment. I am Dr. Claire Vega. See you in the next video.